Hello, my name is Emma Welch. For my career project, I chose to research nursing. For my interview, I actually interviewed one of my coworkers. Her name is Riley Ruckel. She is a registered nurse. She did 3 years of nursing school, and I believe she took her prerequisites at a community college prior to taking her exams and becoming a registered nurse. She's worked as a bedside nurse for the past 5 years, and she just recently switched over to the digital nursing field. So, as a nurse, there are many responsibilities that Riley has. Patient care is probably one of the most important. She really focuses on making the patients feel comfortable, making sure that they feel educated about their treatment, and also assisting the physicians that are working with the patients as well. Um, Making sure that she stays on top of charting and patient notes is really important, and that goes for all nurses, especially bedside nurses. And then in the realm of the digital nursing area, she is really focused on advocacy for the patients and educating them moving forward. As a virtual nurse, her main role is to meet with the patients as they're being discharged from the hospital and educate them on how to further their treatment once they leave the hospital and answer questions or anything like that. So yeah, that's a pretty big part. So, connecting nursing to public health, nurses are really the backbone of our health community, I think. They focus more on individual health, which I think sometimes is a very forgotten part of public health. In order to have a healthy community, it starts with the individual, which is really where the nurses come in. They are incredibly focused on making sure that people have access to healthcare and access to efficient care. That's a really big part of the new sort of emergence of virtual nursing. The online aspect of that has made it a lot easier for people to have access to. A lot of people are scared of the hospital or don't have health insurance or just that doesn't work for a lot of people. So having a virtual option has been really good for a further outreach, which I think is the whole basis of public health is just allowing more people to have better access to healthcare and to have better knowledge of how to take care of themselves. But apart from that, nurses advocate for vaccine programs and preventative health measures as far as maintaining a healthy lifestyle, which is very important because a lot of what people see in the emergency room or what the nurses see in the hospitals, a lot of those conditions or injuries can be prevented with lifestyle changes. So, and the nurses are the ones educating the patients on those things, not the doctors most often. They also participate in a lot of epidemiologic research as far as looking at how diseases spread throughout our community and helping to decrease that. So a typical day for Riley, as I said, she does screenings with the patients who are getting discharged. So the hospital is trying to open up beds. They put the patient on the phone with Riley. She answers any questions about their treatment, any questions that they might have about the future once they go home, things like that. She discusses health education plans with them and then coordinates those plans with their other physicians that are on the floor in the hospital. So yeah. And then the working conditions for Riley, she typically works 44 hours a week, usually 3 days a week, 12-hour shifts, which makes it incredibly flexible for her. She accumulates sick hours each pay period, full benefits, 401k, everything like that. And from what she's told me, the remote work environment with the virtual platform has been incredibly nice and much less physically strenuous than bedside nursing, and much more consistent too. So there's a lot of pros of this career. In the virtual field, the work-life balance is very flexible and it's very preferable. And as I said, working remotely is less physically demanding and it's just more accessible for the nurses, which I think is very appealing. especially for nurses who have already worked in bedside nursing for years. But apart from that, the virtual nursing field is very unique and very specific in the way that it is extremely progressive and extremely centered around growth. Um, Along with the digitization of our world, everything is starting to incorporate AI and technology into these careers. So, progressing into this field of virtual nursing is really important, and I think it's really appealing to a lot of people. It also, like I said, it broadens the reach of who the nurses can help, which is a huge part of nursing. However, there are cons of this career. Riley said that something that's very stressful is when the hospitals go into this red status, which means they basically don't have any more beds and the ER is overflowing. And so Riley needs to check out all the patients, get on the phone, and discharge like all of them at once, which can be very difficult because they all have questions and she wants to dive into their patient education as much as she can to flesh everything out, but that can be difficult when you have to do it really quick. Also, although the addition of technology is great and it makes things easier a lot of the time, technology is not necessarily foolproof, and it definitely has its moments where it does make the patient visits a lot harder, and sometimes they lose connection or whatever, so that could be just annoying. But also, nursing as a whole, Riley has always told me that she feels that when she was doing bedside nursing, she was doing so much and she was asked to do so much for the physicians and for the patients and did not feel that she was compensated correctly. So I think that's a con for a lot of nurses, not just digital or bedside, but across the board. I think nurses would agree with that. So as far as the skills and experience needed for the virtual position, Riley, she's the first pool of this new sector at Sharp, and they were hiring for specifically nurses that already had 3 to 5 years of experience in bedside nursing, which she did. It also required for her to be very comfortable with computers and different technology websites. There's a lot of different charting websites that a lot of hospitals use that they wanted them to be really comfortable with prior to hiring them. And then bedside nursing requires a whole range of physical skills. Okay, so these are some schools that offer a registered nursing program. Some common required coursework is just, general education, anatomy, physiology, microbiology. Ethics is a big one for nursing. And then clinicals, obviously, clinical rotations, skills lab, things like that. And then, so for advancement in the field, specifically in the digital nursing platform, just like regular nursing, as you get more specialized into the type of nursing or the type of care that you're giving, you can get paid a lot more. So going into specific certifications that can help you move up, such as chronic disease management and case management, things like that. Also being a nurse educator. So this means like if Riley were to move into this position, she would be teaching other nurses who are coming into the digital world how to be a digital nurse. So she would be educating people about how to do that entire platform, because it is very different from bedside nursing. So that would be a step up. But digital nursing is really, although it is new, it is advancing a lot. And I think digital healthcare as a whole is going to start getting very, very popular. So the current state of the industry, like I said, constantly growing. The integration of technology in medicine increases daily. We have new things being created all the time. However, Riley does often talk about staffing issues in nursing. There isn't enough nurses. Lots of people are steered away from nursing because they don't get compensated as much as they should for the work that they do. So a lot of that unfair nursing treatment steers people away and causes staffing issues. Um, However, because of the staffing issues, the responsibilities of the nurses have gone up, so they're expected to do more and handle more patients. So, yeah, that's rough. Um, so this is kind of the average salary. It seems as though Riley told me she definitely makes more doing the virtual nursing than the bedside. So I think that is because it's more of a specialized field than just the generic bedside nursing. But as a nurse, you can make pretty good money as you keep moving up, especially in California. I think California makes the most out of any state. But as you move up into, like, if you're an ICU nurse or a trauma nurse, like, certain fields make different amounts.